There he is. How are you, Ron?
I'm doing great.
Good to see
How are
you.
you, Doug?
Good. Excellent. Awesome.
Yeah.
There we go. It's got to be there we go. Yeah, we have to set a better example than some
Yeah.
other people. So, thanks so much for taking time out with us today.
Thanks for
Really,
having me.
really appreciate it. It's really, and I know you're really busy. You had all the kinds of things that you guys are doing and
Yeah.
setting up. It's like it's just moving everything. And I guess in the past we've always had some kind of overarching um, response as a country that we kind of followed, and we don't seem to have that now.
Well,
And so it's kind of like everyone's doing their own thing. So tell me how we decided in San Antonio what to do.
well, we've been kind of working on this for many months now because
Mhm.
the outbreak really started even before the beginning of the year
Right, it's back
in
in
China.
October or so.
Yeah, and
Yeah.
then we were notified by the Defense Department and by HHS that they were going to start evacuating Americans, and they were going to bring them to military bases, installations in the United States. There were, I think, four at the time they selected, and Lacken was one of them. So we've been working through the evacuation, repatriation of Americans who are, through no fault of their own, finding themselves in a
Right.
really difficult situation. They deserve to come home and
Right.
get proper care. We've been working through that to make sure that they can come home,
Right.
and they can come home in a safe way that keeps them isolated so that they don't put the community at risk. That's been going very well
Yes.
until there was the premature release of the one person.
Now
We're-
that person flew in from someplace. Is that correct?
yeah, they were evacuated in the second cohort of evacuees from the cruise ship, the Diamond Princess.
Okay.
And so that quarantine was being executed perfectly as well. But we've been communicating with them. How do you improve your protocols? We need to encourage more testing. We need to do certain
Mhm.
things. And then come to find out they had prematurely released one person. So we were able to, rally everybody, ensure that nothing happened again by using, legal methods,
Right.
but as well as I declared a public health emergency
Right.
at the time to keep more evacuees from being released prematurely.
So that wasn't a community spread. That was actually one from someone that came from a contact or.
Yeah, and it wasn't a spread. So basically, what it was that, and in fact, actually, I misspoke. The person that was released prematurely had tested positive, but then was recovering,
Okay.
and they were from the evacuations that happened from Wuhan, China.
Okay.
So we wrapped our arms around that one pretty quickly. Thankfully, there was no spread involved with that one. We were able to investigate it. The contact was limited, and everybody has been now being observed, and nothing came of that. Now we are into a new phase, and we're actually ramping up to this new phase, which is doing what we need to do to prevent and to contain, ultimately,
Okay.
community spread. Every city in the country in an infectious disease outbreak has to prevent and contain what will eventually be community spread. And so we've been positioning ourselves over the last month and a half to really ramp up the capacity within our medical system and all the other systems in our community to ensure that our community our public is as safe as possible.
Okay. Now, so I saw we have the mobile facility that's gonna
Yeah.
that we'll be using, and that's just initially for first responders. Is that
That's
correct?
right. Yeah. So first in Texas, we're very proud of that.
Mhm.
But it is for frontline health workers and first responders. These are the folks, you can prevent getting sick from this
Mhm.
disease by observing the precautions that health professionals have put out. Social distancing,
Mhm.
washing your hands, making sure that if you're sick, you don't go out in the public, coughing, if you have a random cough into your
Arm or whatever. Yeah.
you can keep from getting sick and prevent others from getting sick if you observe those precautions. First responders, health workers, it's their job to
Right.
put themselves in high
harm's
risk
way.
position.
That's right.
So they are going to more likely come into contact with folks that may be sick,
Okay.
may show symptoms. So we want to have a mobile lab, a stand-up lab, drive-through for those frontline folks
Okay.
to make sure that they're getting screened. If they get in contact with somebody who's showing symptoms, we want to make sure that they're okay.
Okay.
So that's what that is for. We are working on ramping up community testing capabilities. There's a clamoring for that because people are just nervous. I will tell you that community testing is really for assessment purposes. If you the biggest threat here is fear and hysteria.
Absolutely.
So we've got to keep everybody calm because we've got all the
Because
best
us
professionals.
Americans, we love to panic.
Yeah, and it shows in the supermarket aisle right
Yeah,
now.
yeah.
But right now we're in a good position.
Okay.
We can't assume that the virus isn't out there. We have to take precautions and pretend that and behave as if it was. So we're standing up community testing capabilities, but we already have the test here.
Okay.
If you have symptoms that line up and you're feeling sick, you need to see a doctor.
So how would one tell if you have symptoms of COVID-19 versus the regular flu?
Your doctor will know. There are specific symptoms, and I don't want to misspeak, so I'm not going to go into them.
Right. Mm-hmm.
But your doctor will know. That's why it's very important, because we're in the height of the flu season. It's been a very bad flu season as well. And there's cold and allergies going around anyways.
I got my flu shot.
Yeah, well, me too. Me too. So there's a lot of respiratory stuff going around. One small portion of that is COVID-19. So you need to go see your doctor if you're feeling ill, if you have symptoms, if you're coughing and sneezing. You need to go see your doctor. Your doctor will be able to determine and may actually test for the flu, test for flu A and B, and may actually say, no, you know what, we need to test you for COVID-19. If your doctor says that, we will be able to do it. We will be able to conduct that test and eliminate it. In fact, we've conducted a number of tests already and have eliminated it in most of those cases. So we have that capability. We are in a full-on preventative and containment posture right now. And we are working in concert with the region to make sure that we protect our public.
That's awesome. Can I ask you to say something too? There are a lot of naysayers. There are people out there that say that it's whatever. It's a conspiracy. It's not real. It's made up. I'm going to hug people anyway. I'm going to fly anyway. What would you say to those people?
Believe what you want, but it is irresponsible to ignore the health professionals and the data around this, the news that is very clearly showing an outbreak in other countries, and people are dying here in the United States. Thankfully, it's been limited. Thankfully, we have a very modern health system here in the United States and health professionals who are the best in the business. But we have to do our part. You may think it couldn't happen to you. Couldn't be further from the truth. As long as you take the proper precautions, and if you think that COVID-19 is sort of the news cycle,
right, the flu of the day,
believe me, there are over 16,000 Americans who have died from flu this year.
Yes. If
nothing else, even if you don't want to worry about COVID-19, it makes sense to be cautious about spreading disease, even normally, because the flu can harm people who have compromised immune systems, older citizens, all these folks. So it makes sense, whether or not you think this is just a flash in the pan or not, to observe the basic precautions that are stated by the medical professionals.
So now that is thank you for sharing that. So I guess when you look at the last great thing that happened, I mean, it's kind of like people are comparing this to 9/11. Yeah. And so, with the whole 9/11 thing, I mean, that changed the way that we lived for the rest of, to this day. Yeah. And so do you see the same type of impact from this pandemic, so to speak?
I don't know. So I think it's going to give people a heightened awareness of precautions to take during a flu season. Mm-hmm. That's a really good thing. I mean, to give people the advice, if we're next year, if COVID-19 is not even part of the picture anymore, we know the flu will be back around, the seasonal flu. People are going to be more conscious about giving people, a tap on the elbow or something. That's a good thing.
That is.
I think that epidemiologists and medical professionals are now sort of front page news. It's a good thing. I mean, we need to believe and we need to be confident in the medicine that makes us a modern, civilized America. So that's a good thing. But there are some impacts that are just unknown right now. The impacts of the economic downturn in the markets, the impact to small businesses that are really struggling to keep open. That's going to remain to be seen how impactful that is. I'm most concerned about the most vulnerable members of our community.
Right.
Those who, depend on the free lunch program, the free breakfast program at
Right.
school. School's closed. We're trying to work through ways that we can get meals to people who need them. We also know that, some people are going to be furloughed or even laid off.
Laid off.
And folks that really cannot, deal with that.
Right.
Because, they're already on the bubble because of high rent
Right.
prices or whatever. So we got to work through that. We've placed a moratorium on all evictions
Okay.
during this crisis. We've placed a moratorium on all utility disconnects
That's
during
right.
this crisis.
Very nice.
We're working to steer all philanthropic giving towards things like Meals on Wheels and Food Bank. We're working in a way possible that we take care of the most disadvantaged members of our community, and we start to limit, we limit the panic and the concern by getting our health professionals out in the driver's seat.
Well, one of the big things, and I didn't mean to interrupt you, pardon me. One of the big things that I have to say, and some people have mentioned it, postponing Fiesta for 6 months or however, I definitely agree that it was the right thing to do. But the financial impact that it will have on the nonprofits in our city is really, really tremendous. I know because I've worked with a lot of them, and they've been gearing up for their Fiesta events, and they're getting volunteers, and it's a wonderful thing that we do every year. Yeah, but so is there any thought to how we can keep the nonprofit sector? I mean, because some are big. I mean, everyone's not the United Way. Everyone's not the Goodwill. I mean, we have people out there that do great work, but they're living from fundraiser to fundraiser. So how can we help those people?
Yeah, well, it's a great question, and there are so many nonprofits in our community, 100 plus that are associated with the Fiesta, that perform critical, essential services for our community.
Yes.
So those are at the top of my mind when it comes to Fiesta, and it's one argument to make sure that we have a Fiesta this year, and we do it in a safe manner. We'll say the first and foremost concern is to take care of public health, but we do want to see those nonprofits thrive. So we're working on a couple things. Number one, you'll see me out and about. Life should go on. Social distancing does not mean social isolation.
Thank you.
So go visit your small businesses. Go dine at their restaurants. Go, make sure you're buying the flowers from the shop. Do all the things that you would, even while you're, practicing social distancing when it comes to large public gatherings. We want to keep our organizations alive. But we're also working on a fund that folks who are getting antsy because they're not going to the Fiesta parties can donate to help with those nonprofits.
That's all.
But also mark your calendars, because November 5th through the 15th we're going to party like it's 2020. Keep calm and party on in November.
There we go. Yeah. Awesome. How you ought to market that?
Think about
Keep going. Yeah, because it's really, really important. I'm glad you took time out today, because people are just real over the time. Something comes on TV or there's misinformation. I mean, I thought the press conference that we had in San Antonio was very well done.
Thank you.
And I thought the information piece that came out were very informative, very easy to read. And you provided them in sign, Spanish, English. I mean, it's multiple different ways.
Yeah.
So, which I thought that was very, because the CDC didn't actually do that initially. So everything was in English.
We're trying to show the CDC best practices as it relates to San Antonio.
Right.
Yeah.
So I really, really appreciate that. I know you're extremely, extremely busy, but I just want you to know that there are a ton of people listening. I just want to assure people that we have a handle on this, and that you can be who you are, do what you want to do, go where you want to go. As the mayor just said, social distancing is not social isolation.
That's right.
Doesn't mean that you can't go to a restaurant. And there's one more thing I want to bring up. In all seriousness, because I want everyone to hear this from you.
Yeah.
There's been a lot of not here in San Antonio, thank God. There's been a lot of xenophobiaism with the Asian community and Asian restaurants, and that's a problem.
Viruses don't discriminate, and it's been disturbing to see some reports. I haven't seen any here in San Antonio, thankfully. Hopefully, we won't.
No, I checked before you came in. I haven't seen anything.
But where children who have Asian blood have been made fun of in schools and not welcome in certain places just because they're simply of Asian descent. That's horrible.
That is horrible.
Viruses, disease do not discriminate. What we need to do is make sure that people have the facts. We're flooding the facts out there so people can make informed decisions. But again, as this community has shown, we can deal with this in a compassionate,
Right.
rational way. We can show prudence, and we can also show a little bit of gumption when it comes to pushing back on national stuff that's happening that could hinder our own ability to take
Right.
care of people. But we're going to get through this. We're San Antonians. We work together, and together we take care of each other's health.
Together we take care of each other.
Yeah.
You are the man. Thank you, sir.
Good to see you.
Good to see you. We've got Mayor Ron Nirenberg here. Hopefully everyone got the real information. Please be careful. Take care of yourselves. But please, your life. Don't just sit inside and think, oh, my God, I can't go to Arby's. I can't go to the Chinese restaurant or whatever it is. You want to go. Just don't hug anybody. Don't lick anyone in the face.
And for goodness sake, you don't need to buy all the toilet paper.
And don't buy all the there was this person.
Or milk.
Or
anything else. It's going to be there next week for you.
Yeah, it's going to be there. Last thing. This is for sure the last thing.
Yeah.
What about travel?
Yeah.
Casual travel. So let's say I have a wedding to go to. That's a bad example. I got a reunion to go to, and it's in New York or it's Colorado.
Yeah.
I mean, should I do that still?
So be cautious. Making it. There are certain hotspots domestically. We know that they're having containment. They're in containment mode right now in places like Seattle,
right.
For the hotspot. So check out what's going on before you get on the plane. And if you can do without that for
a
if
couple
it's
months
unnecessary,
right.
then maybe you should stay home. But if you have a wedding to go to,
that was bad. The wedding was a bad example.
But if you have a reunion, and life will go on.
Right.
You can take precautions and do it in a safe manner. You can travel and be safe. Just make sure you know where you're traveling from, where you're traveling to, and and if you're just doing it for the heck of it, well, maybe you can postpone some of it, but certainly those essential things can be done in a safe manner.
Awesome.
Yeah.
Thanks so much, Mayor. You're the
Good to see
man.
you,
Keep
you
up the
too,
good
man.
work. All right.
Thanks. Good to see you.
KRVFM, the heart and soul of San Antonio. You're here with our Saturday conversation with Mayor Ron Nirenberg. Thank you so much for your attendance. Thanks, everybody, for paying attention. We'll be back in a little bit. Perfect. Uh-oh.